Good afternoon, everybody. My name is Dr. Chris Bird. I'm here to speak to you on behalf of the Coastal Bend COVID-19 Task Force. It's May 14th, 2021, and this is now your bi-weekly pandemic report. We've moved to giving these once every other week, so the last time that I gave a report was 2 weeks ago. So the task force has two objectives. The task force has two objectives. The first is to address your concerns and questions about COVID-19, and the second is to enable evidence-based decision-making on behalf of our local leaders to help us get through the COVID pandemic. There are interventions that are taking place to control the spread of COVID-19. The biggest one is getting vaccinated. So everybody who's 12 years old or older is encouraged to get vaccinated. If you become sick, even if you are vaccinated, it's still possible that you'll contract COVID or that you've contracted COVID because the vaccines are not 100% effective against illness. They're more like 94% or slightly lower than that. So you should isolate when you're exposed or symptomatic to COVID-19. And if you're not vaccinated, you're encouraged to get vaccinated. Two, if you're not vaccinated, you should continue to wear face coverings and social distance. The new CDC guidelines that say that if you're vaccinated, you don't have to wear your face coverings or social distance inside or outside, with the exceptions being on airplanes. You're still encouraged to wear face coverings on airplanes and in public transportation. Otherwise, if you're vaccinated, you don't have to do that. But if you're not vaccinated, you're still encouraged to wear face coverings in public situations and social distance and avoid crowds. I'll point out right now that the Nueces Knows risk dashboard is about in the moderate level. And I'm showing you a more nuanced view of it right now with the 6 things that are being tracked. There are 6 different categories that are tracked. And across those six categories, we range from high risk to minimal risk, with the majority indicating that there's a moderate risk of encountering COVID when you're out in the community right now. So you can look at this panel to get an idea of the level of risk for COVID when you're going outside and going indoors in public right now. Our number of confirmed cases have really slowed down in their accumulation. There's a 10% decrease in the active cases from last week to this week, and we're at 43,395 total confirmed cases. A confirmed case of COVID-19 is one that is results in a positive PCR test or that nose swab test. They can also do cheek swabs now for that test, but the key is that they used polymerase chain reaction in their test to determine if you're positive for COVID or not. That detects active virus and really active virus DNA that's present in your sample. And there have been 41,585 recoveries. The differences between the numbers here are made up by the fatalities, which we talk about later. The transmission rate this week is down, and the transmission rate is on average, how many people does a person who contracts COVID pass COVID on to? So right now, the average person that contracts COVID passes it on to less than 1 person. Another way to look at this is if 100 people contract COVID in the Coastal Bend, they'll pass it on to an additional 78 people. So in that progression, that means COVID is declining. You can see the model fit over here. This model is fit from last week, but this week we updated it with new data. But we're always tracking the cases very closely. We match the model against cases to come up with this model fit. You can see the drop right here in the transmission rate below 1, and we're projecting that moving forward, if things don't change that much, we can stay at this level, or I even expect that this could go lower if we keep doing the same things that we're doing now to stop the spread of COVID-19. This turns into a projection in terms of the number of new cases in the Coastal Bend that declines, going down to 0 in a month or 2 from now. So that's pretty good news. Sorry, ignore these words here. We're slightly decreasing. right now in terms of numbers of daily new cases, and each point here is the actual number of new cases, and the blue line is the model projection of the number of new cases fit through that. So we're slightly decreasing right now in terms of number of new cases. That's why we're at the transmission rate of 0.78. And if we break this down by age classes, we've got 18 to 39-year-olds, number of cases are down. 0 to 17-year-olds, down in the last week. 40 to 64-year-olds, down in the last week. 65 to 79-year-olds, down in the last week, down to about 0. And then 80-year-olds, maybe a slight increase there in terms of new cases per day, but not very many at all. Right? So very few cases, very few new cases in our older age groups of COVID-19, and that's probably because a higher proportion of people in those older age groups have been vaccinated. If we look at the breakdown of new cases by county, what you can see is that in Nueces over the past couple of weeks, we've had a downwards trend. Sometimes if we had a couple days of more cases, the smoother can turn upwards. We'll see if this trend continues, but the longer term trend over 2 weeks is downwards. And if you look over the past month, we're about the same place we were a month ago. For B County, increasing slightly. All the other counties are decreasing, or the amount of increase they have is so low that it does not really rating on this scale. When we zoom out to the South Texas metro areas, we do see one exception to the general trend, and that's in Victoria. We're seeing in Victoria is since about the beginning of March, maybe the end of the first week of March, we've seen a sustained increase in the number of new cases in Victoria, and you're going to see this borne out in the rest of the presentation. So if you're wondering, is the pandemic completely over? I can point to Victoria and tell you, well, there's this place in Texas, not too far away from where we are, that is on an upwards trend. And it's not just in terms of new cases, we're seeing it in the hospitals there too. So we'll get to that. When you zoom out to the whole rest of Texas, by public health region, though, the general trend is either slightly increasing, slightly decreasing, or staying level. So overall, it looks like all of Texas is staying level, but realize that we're not at 0. 0 is down here, and right now we're up here at about 10 or so new cases per day per 100,000 people across all the different public health regions in Texas. Right, when we look at the hospitals in the coastal bend, and what you see here is the number of patients with COVID, these black dots, that's what it represents, the number of patients with COVID per day that are in the hospitals in the coastal bend, and then the blue line is the projection. You can see that we have a favorable outlook right now, where we're seeing a decline in the number of people that are being hospitalized due to COVID, and our projection indicates that that should continue to decline. Looking at the ICU, we see a decline in the number of people in the ICU over the past week right now, or at least as of May 12th, the last data that I have. There were 19 people with COVID in the ICU, 133 people without COVID, and 152 people total. The blue dashed line represents, on average, how many people were in the ICU in the coastal bend that were getting care before the pandemic started, on average. So right now, we show this to give you an idea of, is there a negative effect of COVID on your ability to get intensive care if you need it? And the answer is pretty much no. Right now, our hospitals are able to meet the demand for intensive care. When looking at the whole state, this is that same graph, but for every trauma service area in all of Texas. So right here, this is exactly the same graph as the last slide, but now we can see it for all the other trauma service areas. And all of them are either staying level, going down slightly, or maybe slightly increasing, with one exception, and again, that's Victoria. Victoria is showing this marked increase that's matching the cases, and so it looks like Victoria right now is experiencing a surge in COVID. Now, it's not nearly as high as the surge that they saw in the winter or in the summer of 2020, but it is increasing, if you look at the slope of that, at a rate that's similar to what we saw during those previous peaks. So I'm watching Victoria very closely right now, and what I'm really hoping for is that this is not going to continue to go up the way that it is. Moving on to the next plot, This is similar to the last plot, except now we normalize it to the number of total patients in the ICU in each trauma service area on May 12th, the last day we have data for. And for that, you can see that in Victoria, there is significantly more patients with COVID in the ICU, percentage-wise, than in any other trauma service area in Texas. And so what this red signifies is the amount of stress or pressure that an ICU is receiving from COVID. So this is right around 33%, slightly above 33%. Right now, the patients in the ICU in Victoria have COVID, and it's been rising. So we're watching this pretty closely. And hopefully the next time I talk to you that this has gone down, and hopefully the rest of Texas has this blue skies image where we see a lot of blue and not a lot of red. Okay, moving on to fatalities for the coastal bend. The fatalities have been declining and then starting to level off, and then they're declining a little bit more. So it's about level to slightly declining, and the projection has it going down to 0 by July. And that'd be 0 fatalities per day on average, and that'll be a nice day if we can get to that. Overall, there's been 1,280 fatalities in the coastal bend, and 809 in Nueces County. What constitutes a fatality here is somebody that has the cause of death, the primary cause of death on their death certificate being COVID-19. If COVID-19 was a secondary cause of death, then it's not counted here. The state counts these from death certificates, and the dates are assigned to the date of death on the death certificate. So I used to say that this leveling off doesn't necessarily show that the number of fatalities is leveling off because it takes them a while to count the fatalities, but now it actually does signify that fatalities are leveling off because we just see this overall trend of declining fatalities. And this is the total number of fatalities that are leveling off here. Moving forward to vaccinations. In Nueces County, we have over 30% of the people have been fully vaccinated. Over the whole coastal bend, the populations range from about 21% in Live Oak to nearly 40%, maybe 39-40% in Aransas County, with all the other counties coming in somewhere between those. Aransas County serving as the leader and the role model for getting vaccinated in the coastal bend. In terms of the whole state, where are we at? Approximately 32% of the coastal bend has been fully vaccinated. I want to emphasize that the percentages that we show here from the task force, it's the percent people that have been fully vaccinated in this slide in relation to the whole population, not just people that are adults, not just people above the age of 12, everybody, because in the end, herd immunity and the spread of COVID is about the total proportion of people that are immune to COVID, and not just which age group that we're in. So that's why we're showing these numbers like this, and that's why it might be a little lower than what you may be used to hearing at other outlets. We will show you those other numbers, hold tight. So in terms of the rise in the number of people who have been fully vaccinated, this is the number of people that have been fully vaccinated in the coastal bend through time. And you can see while there's been some rises and falls, on average, we've seen a roughly linear increase through time from February 1st to May 17th. And while there may be some indication of a decline in speed here, I would say that we're not at the point yet where I would declare that we're really slowing down. Right now, it looks like we're moving forward at about the same rate that we have been for the past several months in vaccinating people, and that's a good trend. Lastly, we're going to break down this proportion of people that are fully vaccinated by age class. And again, the 65 to 79-year-old age class is the most vaccinated in the coastal bend at about between 70 and 75%, followed up by people above 80, and then people from 50 to 64. And then there's a pretty big drop down to people that are 16 to 49. So if you're 16 to 49 and you live in the coastal bend and you haven't been vaccinated, now's the time. You can go to the mall, La Palmera. There are pharmacies that are offering vaccinations. There's several locations you can go to. Vaccinations are free, and it ensures that you won't experience nearly as negative effects of COVID-19 should you contract it as you would have if you didn't get the vaccine, and the chances are you won't catch COVID at all. Now going to the proportion of the population with at least one dose. So the last slides I showed were all people with 2 doses. Now we're going to the proportion of the population with at least 1 dose. In the coastal bend, we're at 39%. And again, this is out of all the people. If you look across the whole state, basically you've got Dallas, El Paso, Austin, Laredo, and the lower Rio Grande Valley vaccinating at a higher rate, at a substantially higher rate than the coastal bend. And then you have other parts of Texas. Here you've got Houston a little bit ahead of us, and the southwest Texas trauma service area a little bit ahead. So we're doing better than a lot of the trauma service areas, but we could be vaccinating at a higher rate. And so this is up to us at this point. It's personal decisions that we make. Do we want to get vaccinated and protect ourselves against COVID, as well as protect our loved ones against COVID or not? And that choice is up to you. When we look at the progression or the trend in vaccinations with at least 1 dose, we do see a significant leveling off now, unlike with the 2 doses. And so if you look at this, as well as here, you can see that for quite a bit of time, since about the end of March, the number of people receiving their first dose has substantially declined. And so moving forward, this blue straight line doesn't fit nearly as well now over the past couple months as the red line. And here, I can't really explain what this jump was, but I do know that the public health department did a huge blitz on vaccinations this week. So it's possible that that is what drove this big jump up. And then we kind of went back to this normal trend. When we break down the age classes by 1 vaccine dose, you can see that we're around 80% of 65 to 79-year-olds, right around 70% of 80-year-olds, followed by 50 to 64-year-olds, 16 to 49, and then we're not really seeing too much in the 12 to 15-year-olds yet, because people that are 12 to 15 years old just became eligible to get vaccinated. We do expect these percentages to increase as we move forward. So in summary, the new cases have declined in the coastal bend, and there's only 2 places in the coastal bend that exhibit increasing cases over the last 7 days, and that would be Nueces, very slightly, and B County. All the other counties, if there was an increase, it wasn't very great, or there's been a decrease, and overall the new cases have declined. Hospitalizations and fatalities are declining across the coastal bend. The transmission rate is down below 1 at 0.78, which means that COVID is in recession. And all that being said, and the fact that if you're vaccinated, you don't have to wear masks anymore, it might give you a false sense of security. And I just want to point out a couple things here. First, a very close metro area to Corpus Christi is Victoria, and it's a COVID hotspot right now. It's not just in 1 or 2 metrics. Everything that we're looking at in Victoria indicates that there is a substantial rise in COVID cases there. Now, it's not super high yet, but if it continues on the same trend that it's on, it could get to be higher. So we want to watch that very closely. We'll get to the other point I want to make at the end of this: stay vigilant. I do want to encourage you to stay vigilant. Get vaccinated if you can, if you haven't been vaccinated yet. If you're not vaccinated and you don't plan on it, we do ask that you continue to wear face coverings, double up if you can between those surgical and cotton masks, and social distance if you've not been vaccinated. There's still cases of COVID out there. COVID is still in the community, and you will be at higher risk of contracting COVID if you're not vaccinated and you're not wearing your face coverings and you're not social distancing. Lastly, the other reason to stay vigilant is seasonality. And this is something that I've noted throughout COVID, through my time on the task force. When you look at the decisions of the CDC and of national figures, basically those decisions are based upon what's best for most of the country. And for most of the country last summer, there was a recession of COVID. There was very low levels of cases in the rest of the country. The exception was here and in places that are farther south. So what happened with us last summer is we had the biggest peak of the whole pandemic. The winter wasn't our big peak. The summer was our big peak. And I want to remind everybody that the summer's coming up again. So at this time last year, we entered a period of time between now and Memorial Day where we had days with 0 new cases of COVID-19. And then after Memorial Day, they really started to pick up. And I want to prepare everybody at the very least to stay vigilant, at least until we see what happens with the seasonality effect that we saw last summer, no doubt. And the rest of the country really didn't see it if they were farther north than us. We're coming into a prime transmission period potentially for our part of the country due to maybe people being indoors more. There's a lot of different hypotheses and data that supports different reasons why in certain seasons there's more or less transmission. But what we do know and what we observed here was that June was a month in the coastal Bend and farther south where COVID transmitted more easily than before that. So once we get through that, I think that we'll be a lot more confident here on the task force about what the future holds. So stay vigilant and tune in, and we'll keep you updated. If we have any updates that are really important between now and 2 weeks from now, we can do an impromptu report again next Friday, but we don't plan on it. Or if there's anything else that we think you need to know, we'll post that on our social media accounts. We're on Facebook, we're on Twitter, we're on Instagram. Our handle is at CBCovid. If you want to give us any feedback, if you want to ask any questions, you can post there. And we'll answer them either there on the social media or on Fridays at 11:30, now half an hour earlier than before. Fridays at 11:30, we'll be doing the Q&A sessions for the task force, and you can either tune in live and ask questions live, or we'll address all the questions that we got on social media from the previous week during that time period. So I want to thank everybody for tuning in. Stay safe, enjoy your weekend, and for those that are vaccinated and you felt that the masks are really oppressive, you can enjoy a mask-free weekend as long as you're not going on an airplane or taking any public transit. All right, we'll see you later.